Attention deficit hyperactivity disorder.
What exactly is ADHD?
You do not have to be hyperactive, bouncing all over the walls, can't sit still, fidgeting, running into traffic, all that kind of stuff to have ADHD.
Do sometimes people use ADHD as an excuse?
Don't get mad at me for having an affair. I just was impulsive. It was my ADHD.
It's not the label that defines you. You shouldn't wrap your entire life and your personality around it.
There are so many wonderful things that can come with having this type of a brain. We are innovators. We are people who bring a lot of energy to a room because we get bored. Look for ways in which you can use it to your advantage.
Don't be ashamed about it. Embrace it and use it in many ways that actually empower you also in your life. Welcome to another episode of Real, Raw and Authentic. Today I'm going to speak to Dr. ADHD, Dr. Jeremy Chapman. He's based in Milwaukee and I'm welcoming him straight to my podcast. Jeremy, thank you so much for being on my podcast today.
Thank you. It's wonderful to be here. I can't wait to have some conversations. Lots of fun stuff to talk about.
Your title gives it all away. Dr. ADHD. I love that. When I read that, I was like, yes, because I have so many questions. But the very first one is, what exactly is ADHD?
Sure. And let me clarify and let me qualify by saying I'm not the only amazing, wonderful doctor who has ADHD who's putting content out there. I mean, there's lots of brilliant ADHD doctors and Dr. ADHDs who've come before me and come after me. So I always am mindful that my handle, it makes it sound like I'm the doctor about ADHD. I'm just one of many, and there are great people making content out there. So what's ADHD? Well, attention deficit hyperactivity disorder is the kind of science and textbook acronym for what ADHD is. Many people, myself included, will tell you that to call it a disorder, as with so many other psychological conditions, oftentimes sells it short because there are so many wonderful things that can come with having this type of a brain if we can learn to identify them, leverage them to our advantage. So, they call it attention deficit hyperactivity disorder, implying that there's two different parts. You can be predominantly inattentive and you can be predominantly hyperactive and impulsive. Or you can be combined version. Okay, so but it's possible to have diagnosed ADHD even if you're not hyperactive and jumping on tables and climbing on couches like I was. If you're someone who spaces out a lot, has a hard time remembering stuff or staying focused, or you misplace stuff a lot, you might have inattentive ADHD. And by contrast, you might be all over the room, bouncing around and doing things before thinking them through, but not have as much of the attentional problems, and you might be more predominantly hyperactive type of ADHD. But it is a condition that has been recognized for a while. I think the current percentages say that between 5 to 10% of boys will get a diagnosis of it, slightly lower percentage of girls, and that's probably because girls are better at masking it, just like with autism. And they don't typically appear as bouncy and chaotic all the times as boys do. I mean, just by nature, a lot of the times it's that boy energy that really signals people like, I can't keep my kid in one place. How do I calm them down? So, and then it persists into adulthood, and I think the estimates are at least half the time. You have a lot more adults now getting diagnosed with ADHD for the first time in their adulthood. Now, part of the criteria is that it was there all along. But these are people who go, oh my gosh, that's me. I never realized it. That explains so much about me. And one other thing I'll mention is that our society, our tech-based culture, our iPhones and our apps and games, they do just predispose all of us to that ADHD type of brain where it's much harder for adults and kids to delay gratification. We get frustrated if something doesn't load and within 2 seconds. Right? We watch shorts, we watch 10-second clips and we scroll if we're not interested within the first 3 seconds of it, right? And we're not good at waiting anymore, I think. And that's society-wide. So I think you're going to have more people identifying with the symptoms of ADHD, thinking that they may have it. And I think it's a matter of degree. I mean, we all get distracted. We all are trying to do multiple things at once. But it depends how much it's debilitating you and getting in the way of your
Mm-hmm.
life when we talk about diagnosing it.
And when you mentioned that, that's the first thing that comes into mind. Do you think this is one of the most over-diagnosed, let's say, things these days in modern life, because it's so hard to distinguish between, well, is it just a habit of scrolling and being less attentive, or is it
Sure.
really ADHD?
Sure. It's a great question. I think there's a couple of things I'll comment on with diagnosis. One is, for better or worse, a diagnosis is a kind of a gate between, you have to get through that gate to get medications for ADHD. And medications for ADHD are very powerful and potent. They're some of the most scientifically backed interventions in all of psychiatry, actually, in terms of the effect that they have, the effect size for treating the symptoms. So more so than antidepressants and other types of medications, they're just very profoundly effective. These are the ones where people will say, "Oh my God, 2 days in, my child is a completely different person." And the challenge is that the ADHD medications, typically stimulants, are sought after. I mean, they have street value in a lot of cases, because even if someone doesn't have traditional ADHD, they can give someone a feeling of, almost like extra energy and positivity. And so there's reason to want the diagnosis, we'll put it that way. And there was just recently a company that was sued and basically found guilty of developing an online service for mental health. And it was notorious for making it very easy to get stimulants. And so people would go there, they would say, "Oh yeah, I have this, that, and the other thing." The e-doctor would diagnose them with it and then write them a prescription for stimulants. So in that sense, I think that's where part of the concern is, that it's like kind of easier to get the diagnosis. Other important thing for me to just mention here when you talk about overdiagnosis, I'll be remiss not to say this, is there are some really, really unfortunate and unacceptable racial differences in diagnostic practices with ADHD. And what I mean by that is there's another disorder in our DSM, in our textbooks, called ODD, oppositional defiant disorder, which I hate. I don't ever diagnose it. In fact, if I see it in a chart, I usually change it to something else, because there's always something better that explains it. The essence of ODD is this kid is basically a brat. I mean, that's really... The oppositional defiant disorder, can you imagine? I mean, it's just like negative adjectives about someone. And
how
the
does
name
it
of
look
that
like
disorder,
in behavior? What would you see?
So they're always saying no, and they don't want to do anything that you want them to do. And they're always, they're getting mad and having tantrums and fits. They're oppositional. You say, "Let's go to the thing." "No, I don't want to go to the thing." "Let's have chocolate ice cream." "No, I want vanilla." And then you give them vanilla. "No, I want chocolate." So that's the oppositional. And then the defiant is they won't do what you tell them to do. Of course, the opposite of defiant is compliant. They're not compliant enough, so we're going to pathologize them and call them ODD. And the problem with that is it's a negative stigma. It blames it on the child. And then you see it in the medical chart or in the school, kind of education plan, that the person has this and their reputation precedes them. People expect the worst from them. Teachers go, "Oh, this is an ODD kid," right? It's used as an adjective now. Or they show up at the hospital or in a psychiatry clinic and they have this history of ODD. Uh-oh, here we go. It's going to one of those kids. Oh. So it just doesn't serve them well. It sets them down a pipeline towards other diagnoses, such as conduct disorder, because people are just looking for the worst in you if you have ODD, and they're just viewing you as this kind of a rotten kid. So usually ODD is actually a manifestation of one of many things. ADHD, depression often manifests as anger and irritability in kids. Trauma-related history can make people really resistant to being told what to do, right? As they fight for their autonomy and independence. Anxiety disorders can manifest as ODD. So I personally am always saying, I click my little button, I go, resolved, better explained by ... And then I put the other more empowering, more humanizing and dignifying diagnosis in the chart. So the reason I bring up ODD is because this is factually true. If you look at diagnoses and you stratify them by race, Black children more likely to be diagnosed with ODD, and the white children are more likely to be diagnosed with ADHD comparatively. And that, as you can imagine, that sets them on two different courses. It stinks. And you have people, again, showing up in different areas and schools and stuff. And lo and behold, you see a black boy doing something and you see a white boy doing the same thing, and one of them is viewed as more problematic and oppositional and defiant, and the other one is viewed as, oh, he struggles with ADHD. We need to help him. We need to give him, resources and medications and supports and accommodations. Whereas the other kid, oh, he's rotten. We need to contain him. We need to put him in his own separate classroom. He's distracting the other people. It's like this guy's causing other people to be distracted, and this guy's being distracted by other people.
This is like punishing.
Oh yeah, absolutely.
Punishing the one that's labeled ODD. Do I see the difference, or is it exactly the same signs? Let's say, let's go for boys. Is the sign in ADHD and ODD the same?
So the symptoms can be the same. For example, difficulty sitting still and staying in your seat, right? Or easily getting frustrated when you don't get the outcome that you want, right? Come on, I wanted to go play, PlayStation right now. And then, being kind of impatient, or impulsivity, right? So somebody's, a kid is bothering someone and the ADHD kid goes and impulsively swats them or punches them or pushes them. Oh, well, it was an impulse control issue. They just couldn't hold down their impulse, so they need better treatment. Whereas the same exact behavior, if viewed through the lens of ODD, it's like, oh, they're destined to be a criminal. They can't hold it together. They're a problem child. So, and then as you would imagine, as someone who knows a lot about trauma, I would call it diagnostic trauma. I think you can actually get trauma from being mislabeled with a negatively stigmatized diagnosis, because it's going to follow you around.
I totally agree. That's why, and you said that off record, and I fully agree with you. It's for the insurances. It's not the label that defines you. It's something that you shouldn't wrap your entire life and your personality around. It's not about that. It's rather with the symptoms of things that you're maybe struggling with and you need support with.
As doctors, we should be using diagnoses to help someone, to set up supports and not to just send them down a terrible path. It's a disservice to patients. Mm-hmm. And I think that it should be removed from the DSM. Keep in mind, the Diagnostic and Statistical Manual, which is our little kind of like our Bible of diagnoses, it used to have things like homosexuality in it as a definable mental illness. So over time, it does evolve. Right. And hopefully that will be one of the next steps. But, it takes
I love that you say that, because even if it's the Bible, but this is one that evolves. And I like that you said that, because a lot of people refer to it as it's set in stone and it's written there in forever. No, this is something where we as experts and specialists have also a fair share in it, in developing it further and really going into it. That's what the researchers of us do for us, but not everything that's there means it's that black and white.
Yes, no pun intended. And it's man-made, and it's old white man-made, right? In the original inventions of it. And there was a lot of sexist diagnoses, hysteria, right? Something was hysterical, which was always applied, more towards women. So there's just, thankfully, a lot of that stuff has been removed. Each time they come out with a new version of the manual, it's making a little bit of progress. It's more humanistic. So hopefully we'll move in that direction.
Dr. Jeremy, I am also thinking of something that you said earlier, because you said a huge percentage or a larger percentage of boys are identified or diagnosed with ADHD, whereas it looks often very different in women, in girls. If you could give a little bit for the listeners and the people that are watching this, signs to look out for, if they look back and think back of their own childhood, they could identify whether they were dealing with ADHD symptoms or not. What would they be?
Sure, absolutely. And very, very important to consider, because you have a misdiagnosis and it's a missed opportunity to really support someone. So again, and I've made some posts about this too, you do not have to be hyperactive, bouncing all over the walls, can't sit still, fidgeting, running into traffic, all that kind of stuff to have ADHD. You can be someone who is totally calm and able to sit still, but is spacing out, daydreaming a lot, needs to have things repeated multiple times for it to register. Or maybe you're reading a book and you have to reread the same sentence several times before you can actually internalize what it means. When I read, sometimes I'll get so distracted by a wrinkle in the page, or an ink blot, or something that is not part of the actual content of what is being said and heard. If you were losing stuff a lot, misplacing stuff, or disorganized, or always late for stuff, or if you were procrastinating until the last minute, or if you had a hard time starting things or a hard time finishing things, by the way. Many people will take up a hobby and they'll get into crocheting and they'll buy all the materials and equipment for it. And then, after the novelty and excitement of it wears off fairly quickly, then they're taken up by the next interesting, trend or thing. And with relationships too, by the way, right? It's a very classic thing to have a very exciting honeymoon phase in a new relationship when you're dating someone. Oh, you're so sweet and charming. You're getting them flowers, writing them cards, showing up with surprises, because that's very stimulating to the ADHD brain. There's so much dopamine being released. You're seeing your new partner smile and laugh and all this reinforcement. But inevitably, as the relationship continues, the sense of novelty dies down. It attenuates, and the ADHD partner tends to get a little bit more bored, and then they're looking at someone else and, oh, that person, what would it be like to be with that person? So it's very, very treacherous, actually. And so it's important for the ADHD partner to continue to look for ways to keep the relationship interesting and fresh with new experiences and stuff. There's some great books about that too. But I digressed, as I tend to. If you are thinking back to your childhood and you had some of those things that I was just talking about, that might be signs that you have more of an inattentive form of ADHD, where you just you would benefit from certain interventions. Put it that way.
Mm-hmm. And if I'm now, let's say, an adult and I've never been diagnosed with ADHD, but I think maybe now, let's say I looked into content and I saw exactly the signs that you've mentioned. I'm inattentive. I'm struggling with the focus on the sentence and actually let it sink in. And you name all the other things. How do they know what to do, and what's the next step if I can relate to it as an adult? What would I do?
Absolutely. It comes down to what you'd want to be different about your life. You may be thriving and succeeding in your family and in your work, and maybe your brain has over time just learned to accommodate itself and to build in reminders and systems like that, and you've got a lot of workarounds and you're doing great with it. And maybe it's even helping you in the sense that, because ADHD people tend to be creative because we're driven towards novelty, and we mix things in new ways, and we're open to consider ideas that other people might have automatically ruled out or not even considered. So you might be fine with it, and you might just be good to have that explanation of, oh, that's why my brain is that way. You might want to just gather more information about it by following more accounts to learn more about it and get little tidbits and tips. You might want to branch out and look at some of the great resources in magazines or organizations or even Facebook groups and stuff where you can connect with others who have it so you can learn from each other. Of course, there's amazing books as well about ADHD. The ADHD Effect on Marriage is an amazing book if you discover that you have ADHD or your partner does. And, even if you're not married, obviously, but it's you'll be like reading your life as you read that book. Oh my gosh, other people have this too. And that can be very, very, exciting to learn that you're not the only one. If you do think that you would want more formal treatment, such as medications, you would have to bring it up with a doctor and have them screen you for it. And like I said before, technically speaking, if we're going by the book, ADHD symptoms would have had to have been present in your childhood. Even if you're getting diagnosed as an adult, they would say, think back to when you were young. Did this, that, and the other thing happen? And you might benefit from a low dose of a medication, absolutely. Or just some other ADHD type therapy, executive functioning skills training. I mean, there are people whose job is ADHD skills coaches too. There are great ADHD coaches online who that's their whole specialty. They're not even physicians, but they oftentimes have ADHD themselves, and they have classes or support groups, and they can give you one-to-one customized, advice based on your life. One of my favorite things, I'm trying to remember if I mentioned this to you, if it was a different podcast, but did we talk about FocusMate ever? I don't know if we did.
We did. Yes, we did. Yeah.
Yeah,
in our
right.
Instagram live, we did.
Yes, exactly. So that is a free website. I mean, you can pay for more features where it pairs you with somebody from around the world, and you basically are do a video call just like this, but you're muting yourselves and you're just doing work. So
Oh yeah.
I'll jump on FocusMate and I'll say I want to make an appointment for 9:30 a.m. for 25 minutes with someone, and I log on at 9:30 a.m. and I say, hey, my name is Jeremy. I'm writing notes right now. My goal for the next 25 minutes is to write 10 patient notes. What's your goal? And they introduce themselves. My name's Caroline, and I'm trying to edit my podcast episode. Okay, great. See you in 25 minutes. And then we mute our mics. We do our stuff. And then when the bell rings, hey, how'd it go? And it's amazing how much I want to make that stranger proud of me. I don't want to disappoint them. And also just the fact that they're seeing me and I have a defined period of time and a defined goal for it. And I stated my goal, then I want to come through on it. And it's magical for me. Like, it's one of the best ways, because when I'm doing a live FocusMate session, I'm not going to go, oh, I think I'll go grab a snack. Oh, I meant to go fold that laundry. Like, I'm focused. I want to do this.
And this really helps with procrastination, the way you describe it.
Absolutely. And it's about breaking things down. So that's one of the things that I talk about all the times with families is, and this applies to adults too, there's no such thing as a large task. There's only collections of small tasks. And if you can define them that way, I could look at my inbox and say, oh my God, I have 50 emails to go through. That's going to take forever. And it's daunting and it's overwhelming. And with a kid, right, I have to read 200 pages of my book. I have to write a 10-page book report. That is a scary thing. But if you can break it down into small tasks, 1 page at a time, 1 sentence at a time, then that's much more manageable to look at. And you have to block the rest of the stuff out. And I will tell you, where's my M&Ms? I keep a big thing of M&Ms by my desk because I use those as reinforcements. It comes down to dopamine as well, which is one of the chemicals in our brain that regulates motivation and the sense of reward and pleasure. And then remembering how that felt so that next time you will be motivated to seek that feeling again. So something like FocusMate, for example, I get a little bit of dopamine after every 20 minutes of work because I've made someone proud. I feel proud of myself. It's like accomplishment. I get to check that off. And that fuels me through the next bit of effort. And I with my daughter who has inattentive ADHD, not very hyperactive, but we noticed she was spacing out. She went from 60% on her spelling test to 95 to 100% on her spelling test when we got her on a low dose of medication, because she was able to focus and stay on it. But also when she has a whole big homework assignment, like she has a math page with like 10 questions on it, I will literally I use candy or I'll use cereal or something, and we'll spread them out on the page like little mileposts. And so she can see, all right, I got to do questions 2, 3, and 4. And then I earn my next little reward there. I have no shame in doing that. And a lot of parents will say, oh, at 10 M&Ms, 10 problems, maybe you can just give her one after each problem. But that's actually a misconception, because the hardest one by far is the first one, because you have to sit down, you have to take out your book, you have to transition out of what you were doing before, and you have to get in the mentality. So I'll usually give 1 or even 2 just for sitting down and opening the book. Then once we build some momentum and the dopamine is flowing, we ride the dopamomentum towards the next question, and we can get through it that way. So there's a whole science to how you distribute rewards. And with ADHD people, it's so important to be mindful of how their brain works.
Oh, that's really helpful. How could I do this as an adult? How could I reward myself that way?
Same exact way. I will put some little pieces of candy out and I will spread them out, and I have to have the discipline not to eat them all at once, of course. But you'll be amazed if you tell yourself, all right, I can get one of my cashews, one of my pieces of whatever after each note that I write. Soon enough, your brain is able to space it out. Then the next time you can do every 2 sentences. Maybe next time you can do every 5 sentences. So you're teaching your brain to extend the amount of effort that it can put in between rewards. That's the thing. It's sustained effort without reinforcement. That's what we need to expand in someone with ADHD. And it starts out very small. And it's the same with adults as it is with kids. And frankly, it's the same with humans as it is with other species, right? Because we have little rodent brains inside us, more or less. And our brains have become more complex as we've gone through evolution. Right back there, look how big they are now. But But in the middle of that, I could really take it. You know what? Why not? Let's do this.
Yeah, show us the brain.
Let's
Great
look at the
one.
brain. Why not? Okay. Let's see if I can get this apart. This is kind of hard to pull apart, but it's worth it. So it's a cool model too. So like, okay, look, it's the inside of the brain right here, right? Here's the whole brain. Here's the inside. Now, human beings have the cortex and the neocortex, and that's the most outer layers here, and that's the most developed in us. And this is where we have all of our intelligence, advanced language, and reasoning skills, right? And as long as we have the brain here, I'll just tell you this. When you're looking at the brain, the prefrontal cortex in particular, is where executive function, planning, stuff like inhibition and resisting impulses, all of that lives there, okay? And so people with ADHD have been shown to have a thinner, more poorly or underdeveloped prefrontal cortex. So that's the part that said, whoa, don't do that yet. Let's finish this. Or are you sure you want to do that? Is that the right choice? Or, okay, I first have to go there, then I have to open my backpack, then I have to take that out. So complex tasks like that are governed by up here. And not only do ADHD people have a smaller one, but it's one of the last parts of the brain to develop. So teenagers, oftentimes, they haven't fully developed this part of their brain yet, which is why they make impulsive, poor decisions a lot of the time. They just don't have the tools yet. And this is also the part that can maybe help with the patience and the internal sense of reward. So a lot of parents who I talk to will say, I don't want to give my kid a treat every 5 minutes. Then they're just going to develop and have a brain where they always, their whole life, need external stuff and they have no sense of internal motivation. That's just not true. You develop this over time. I can tell you, I still use small bits of reinforcers, external ones, but I also have I've developed this internal sense of it feels good to get to do good work too. Anyway, so the part of the brain that where, well, it's going to be hard to show on here, but in here you have some dopamine circuitry and a reward circuitry where basically the dopamine is produced and released in the ventral tegmental area, and then it lands in the nucleus accumbens, very nerdy scientific terms, and that's the nucleus accumbens is the part that goes, I need this now, I want this now, and then there's the prefrontal cortex over here that says, hold up, we'll get it in time, let's finish what we're doing first. If your brain could talk, I want to do a series actually of if your brain could talk, and talk about what the different parts of the brain actually say essentially to each other and how they communicate. But we want to cultivate that stuff. One of the things that you have to keep in mind is, people say, well, I don't want my kid to, I'm not going to bribe my kid with prizes and treats and money just to do what our expectations are. Well, guess what, adults? We have jobs and we get rewards. They're called paychecks. And those are our reinforcements, the dollars and the euros that we get.
True.
It's all the same. You're putting in effort and you're getting rewarded for the effort. And that reinforces when you get up each morning, why am I going to work? Oh, right. It's that paycheck that I'll get. Or maybe you just enjoy your job too, and that brings you the dopamine.
True. This brings it very much in perspective, and I like that little tip with the M&Ms. It's very helpful, and I like these practical things also. I read somewhere in an article, and I would love to hear your take on it, even if it's true or not. But I read it somewhere a long time ago, and I was like, it was for me a bit of an aha moment when it came to the ADHD, because a lot of times it's also the way maybe society is built right now. It became this negative sort of labeling of like, oh, the ADHD people or children who grew up that way, with this constant negativity towards their behavior. Whereas when I read the article, in the article it was written, ADHD or these brains were needed. Those were back in the long time ago, the hunters, the people who thought creative of how we get food. Is that true?
So there's something called latent inhibition, which basically is how much does your brain filter out new stimuli? So someone with ADHD might have a decreased ability to inhibit new stimuli. So, you're 10 people in a room and we're all just kind of writing an assignment, and then there's a noise outside, an animal or a car driving by. Someone with ADHD is more likely to get that stimulus is going to make it into their brain and take over their attention. It's going to hijack their attention because they have poor inhibition, right? And that's why they get distracted, because their brain doesn't do a good job of filtering out the message from the noise. So when you're talking to someone and you say, hey, it's time to go do your homework, the person might be noticing something about your hair or about the way that the light is glistening on your glasses or something like that. So we notice details that other people might not, and we are open to them. We consider them. We're walking, you're walking outside and you see a pebble, and hey, isn't that a funny shaped pebble? And you pick it up and you look at it, and and you're staring at it more closely, and you're noticing patterns. Oh wait, that pebble has more dirt on it than this one. I wonder why. And then you notice, oh, there's a tree. And then you start to piece together things that other people just simply wouldn't have even considered because they're walking by. They're focused on where they're getting, so they don't notice some of these details. So they do miss opportunities for innovation. I think that's really what it comes down to. Whatever animal was the first one to, notice a coconut fall on the ground and it opened up, and then they were able to get the delicious insides of the coconut, said, wait a minute. Whenever that falls out of the tree, oh, what if I were to go up there and throw them down from the tree? And then that was the person who realized that they could actually do this themselves because they noticed something happening. So that is, I think, a very adaptive aspect of having a flighty attention, is that you are open to possibilities. And say there's 10 people in a room and they're brainstorming a new product. We need to come up with a new toy for kids this holiday season. And someone with ADHD notices something about the table or whatever, and most people would just ignore that and brush it off. The ADHD person might say, wait, what if we take that and combine it with that? Wouldn't that be interesting? And so that openness to new ideas and new thoughts is what really helps people with ADHD innovate. And
To narrow it down, can you name 3 positive things about ADHD?
Oh man. Okay. So creativity we just talked about, right? Which is rooted in our drive towards new and novel things, right? So we are innovators. I would also say positivity in a lot of ways. We are people who bring a lot of energy to a room because we get bored. And we don't want to be in a boring place. And I don't want to be on a boring podcast. So let's bring your podcast is not boring. But you know what I'm saying?
I know what you mean. Yeah.
I want things I get bored easily. So it's gonna be inevitable that if I'm part of a conversation or something, I will do something that is maybe more high energy. So we can really light up a room a lot of the time. And people enjoy having an ADHD person at the party because we're likely to go out there and, hey, this is another thing. The impulsivity can work in our favor too, because we're probably less inhibited. So we're the one who's going to be out there in the middle of the dance floor and grabbing people and pulling them out to dance with us because we're just we don't overthink things and we're not paralysis by analysis. We'll jump right in and give something a try. So I think that those are some of the great traits about ADHD. Obviously, I could go on and list more and more of them, but you asked for 3, so I'll stop there.
Thank you so much. Dr. Jeremy, I'm thinking also about medication. My question is, should everyone with ADHD be on medication?
Good question. No. And only use it if it's going to be helping you. First of all, we talked a little bit before about there's a lot of non-medication approaches to ADHD. You could just you should get some skills training. You could get some good organizational tools. You have to try things out, maybe writing things down. Sometimes I like to go old school. So look, here's what I'll do. This is very, analog. I'll take a piece of paper. I write the day of the week and the dates. I actually write my name on it because it makes me feel like I'm in school. And then I go 7 a.m., 8, 9, 10, 11, 12, whatever. And I put check boxes for what I need to do. And then I get to get that dopamine hit of checking something off after I do it. And usually once everything's checked off, I do that because that's satisfying to me. And I chuck it into the recycling bin. That has nothing to do with medication. That's just a skill. That's just a tip. The M&M thing we talked about, the Focus Mate, those are all non-medication approaches. And that may be all you need. However, you might find that and talk to your doctor about this, obviously, that a low dose of a medicine can help you just a little bit more. Because what it does, so the ADHD medicines, the stimulants, they increase dopamine and norepinephrine, but they regulate them. Because folks with ADHD oftentimes have a kind of a shortage, for instance, of dopamine, so they don't get that natural sense of wanting to get things done or feeling good when they get something done. So this helps to increase their motivation levels and also their alertness and their ability to focus on what's going on. And so they're not spacing out quite as much. That can be very beneficial. However, you might also find that you start a medication for ADHD and you have side effects. A lot of the traditional ADHD medications can decrease appetite or they can disrupt sleep, as you might. And sometimes it can make people a little bit more like on edge too. So this is the way I describe it. ADHD medicine, like a stimulant, is kind of like putting gasoline in a car. It gives you fuel to do something. And it makes you want to do something, right? Because once you have that increased dopamine, and we talked about those parts of the brain, it's like, I want things to happen now. I want things to get done now. And if you just pour a bunch of gasoline into a car without somewhere for it to go and not giving it a map, then it's just going to explode, right? And so a lot of times parents will start pumping, the stimulant into a kid and the doctors will just give higher and higher doses. But if there's not a clear plan of what to do with that newfound motivation, like, okay, now let's have a star chart where they can earn stars for getting their homework assignments done, whatever, then it's just then these are the parents who come back the next week and say, it's just making him even more irritable. He's having even more tantrums. We have to get off it. And I go, well, did you pair it? It's like a fine wine pairing. Did you pair it with a reinforcement system so that he has something to put that towards? And what I find is when we develop a good star chart or positive reinforcement plan, and we pair it with a stimulant medication, then it makes them really motivated to get those stars. It makes them really feel the good feeling of the positive praise from their parents and the sense of accomplishment themselves. And it makes them more likely to remember how that all felt and then seek it again next time. So that's when the medicine is used in a very effective way.
Do the kids, for example, or also adults then have to stay on the medication for their entire life?
Awesome question. So first of all, medically, physiologically speaking, ADHD medicines, a nice thing about them is that they're less likely to have like a physiological withdrawal. So certain like anxiety medications, like, people who take like Xanax or Ativan or something like that, might have physiological kind of dependence on them after time. And you can't just suddenly stop it or it'll be, biologically, it'll be damaging to them. ADHD meds, not the same. Many people actually take it 5 days a week and then take a holiday every weekend from the ADHD medication. And then they'll restart it a week or during the work week because that's when it's needed the most. Some people don't like having it in them on the weekend because they like to just, kind of let's be low key and stuff like that. So that's a common thing done. Or people will take the summer off, during the summer break from school. That's totally legit too. And then, yes, you can have different periods of time. So I've been on and off stimulants myself over the past few decades. When I was studying for the MCATs and I had my whole reinforcement plan, you better believe I was taking the stimulants and I was doing all these practice tests over and over again. And it was really fueling me through that. Other times, I haven't needed it. Sometimes I get really ticky. I get more, addled. I get more like irritable. And then I go, well, maybe I'll take a break from it right now. I wouldn't recommend, and again, I'm not anyone's doctor on here, but I wouldn't recommend using it just as needed. Oh, this day and then not that day and then this day. Like it should, I personally think you should be either in a phase where you're using it or not like a totally mixed match day by day.
Does it change? Does the ADHD medication change the person that I am?
Like your personality? Hopefully in a good way. I mean, hopefully it makes you more reliable and following through on stuff. Hopefully it makes you more present and attentive to what's going on. If you're with your kids and you're not just spacing out and scrolling on your phone. Hopefully it makes you more, maybe even able to stick through with a relationship or a job and, see the big picture and be able to take it day by day. That would be one of the potential benefits to your personality. Yeah, some people feel as though when they start meds, they lose their vivaciousness. They lose their spunky, impulsive, happy-go-lucky, easygoing self because it makes them more like a robot focused on getting things done. That's where it comes into balance. What is the right dose for somebody? But it's not for everyone. And some people really just, it doesn't jive with their brain. Absolutely. It just shouldn't change your actual outlook on, or your other aspects of your personality. It just changes how they manifest, I think.
Is one of the major, let's say, signs that the medication is working for you that you feel more connected and more happy in your own life? Or is it also that we need to look into how am I fitting into society.
Oh, it's a great point. Yeah, I mean, the goal of this, we shouldn't just all be trying to fall in line, and comply. Like, back to the ODD thing. You want to be able to function. You want to be able to do the things you want to do. If you want to be a doctor, you're going to have to be able to get through med school. And if this will help you get through med school, great. The point is not to be like every other doctor. And, you hopefully will be a doctor who still wears a goofy suit if that's what you like to wear on a podcast and can relate to that. I mean, I think that's a very, very important thing to keep that in mind. Anytime you're starting a medication, you should have a conversation with the doctor at the outset, and your doctor should be doing this. What are we going to look for? How are we going to know if this is working or not? How are we going to know if it's not going to be working? I don't just stop at like, oh, I'll be focusing better. No, like, how are we going to quantify that? I'll have fewer late assignments, or my scores will go up on my assignments, or I'll have fewer, times when I get in trouble for blurting things out. Like, we have to have some way to quantify before and after effect on stuff. And if you are an adult and you have a spouse or kids or bosses who can also be included in the conversation, you can say, let's keep track of how I'm doing with this stuff. Hopefully they will, engage it, and they'll realize that it's in their own advantage to help you with your skill development. Maybe you make a star chart or whatever. Maybe you say, hey, how am I driving? Once a day to your husband or wife or boss. How do you think I did today with paying attention to stuff? Things like that. Because that accountability is very powerful reinforcer.
And how do we, let's say in adult life, how do we support a partner who has ADHD, where we don't lose ourselves in supporting them entirely or taking up too much, but how do we support them the best way?
Awesome point. I mean, I did mention that book. There's a lot of good ADHD effect on relationships and marriages books out there that will really give you a lot of the tools that you need. Couples therapy, by all means, I would recommend, because they can look at things objectively. They can be the one who says, you're overextending yourself there. Or maybe you do a little bit more to help support them. But if you're feeling drained by your ADHD partner, that's a sign that either they need to be doing some more stuff to get some more formal treatment. I mean, you could also just encourage them to get evaluated or get some treatment or read a book with you and see if it relates to them. Because sometimes the person is in denial or doesn't want to, view themselves as having something wrong with them. I highly recommend, honestly, a lot of people say, well, I don't want to parent my spouse. I don't want to baby them. I don't want to be their teacher giving them little rewards. And I get that, but it comes down to which is more important to you. Do you want them to be functioning at their best? It is a disability, and you have to view it that way. And if your spouse was in a wheelchair, you would push the wheelchair. And if you can understand that this is a different kind of a brain and it's something that they struggle with, they're not doing it to be lazy. They're not doing it to be irritating or annoying. They're not just irresponsible. If they're doing the best they can, then I think it's reasonable for the partner to jump in and get into the system and cheer them on and be, their best advocate and say, great job. That's awesome. You remembered to bring Jacob's hat to school this morning. Good job.
Jeremy, I'm going to say something controversial, maybe difficult for anyone who's watching and listening, but I would like to have your take on it.
Yeah.
Do sometimes people use ADHD as an excuse, saying, I have ADHD, therefore you have to take it or leave it, in a relationship, as an example?
Oh, for sure. I think that anything can be kind of, unintentionally or intentionally weaponized in a certain way. I have ADHD. You need to give me more chances. You need to forgive me. Don't get so mad at me for not taking the trash out. It was my ADHD. Don't get mad at me for having an affair. I just was impulsive. I mean, it depends how far you take it.
Yeah.
Same with depression. Oh, don't make me do anything. I'm having a depressed day. I mean, you might be, and absolutely that should be validated and honored. And who's to say if someone is, or I'm too anxious to do that. I don't want to do that. It's making my anxiety. I don't think that they're doing it in a vicious way. I don't think people are consciously doing it in that way, but people might be more likely to fall back on it as a crutch, more like, they don't want to push themselves out of their comfort zone. And so, yes, it can be definitely used as like, I don't want to be held as accountable. And that's on the ADHD person to say, look, I need to be doing everything I can. I need to be getting the treatment I can. I need to be stepping up. for my partner so that they're not doing all of the thinking and they're not doing all of the responsible stuff. Yes, people can certainly kind of abuse it. I don't think the people do it like knowingly or intentionally very often. Same with trying to use some other diagnosis as an excuse to get out of something. More just that maybe they are feeling more overwhelmed. Maybe it is partially or mostly related to their brain difference. But I would say maybe the key barometer there is, what is the person doing about it? If someone is saying my ADHD is the reason why I didn't get my work done, or I didn't remember to pay our taxes or something like that, and they're not doing stuff to treat their ADHD, like seeing a professional, a therapist, a doctor, taking medications, working on, skills, writing things out, setting alarms. If they're not taking steps to address the ADHD, but they're simultaneously using it as an excuse or a rationalization for their behaviors, then I think that that's problematic. On the other hand, if your partner is genuinely appears to be doing what they can, reading about it, listening to podcasts about it, taking some, some help from professionals about it, and they're still struggling, I think then it's more reasonable to say, okay, I understand. Let's figure out a better plan for you to remember to take out the trash. And maybe we need a visual reminder there. Maybe we need another alarm. So with any mental illness or physical disability, being quote unquote used as an excuse, let's look at what the person is doing for it. And if they're willing to make changes to try and fix it.
That is an important one. Being accountable for your share in a relationship, regardless of what you're dealing with.
Yeah. That'd be problematic if someone said, oh, I forget to take out the trash because I have ADHD. And then the partner says, well, let's make it take out the trash alarm. And then the person says, no, I don't want alarms. I don't need alarms. That's a red flag to me then. Yeah. Because you're not willing to work on it.
Great point. I have another question for you. This applies maybe more to adults who are dealing with ADHD. And this is a question out of the Netherlands. So be prepared. What's your take on marijuana? Because I see a lot of people who use this as a, let's say, support, maybe crutch. That's my question to you. Is this beneficial in terms of treating ADHD, or is it more like a Band-Aid, a plaster over a wound?
Where do you draw the line? I mean, I try to say, look, is it helpful or not? So, of course, in medical school right now, we're not trained in prescribing any kind of controlled substance, CBD, THC, psychedelics. It's not something that I learned in medical school. And so I think there is a bit of a kind of elitist sometimes approach where doctors will say, if I didn't learn about it in my medical textbooks, then there's no way it can be real. And that's not just with something like marijuana. It's also like certain supplements, right? So people want to take certain vitamins or certain things that, nutritional, non-medication, herbal things and stuff like that. My take is I don't have a professional opinion on it. I simply didn't learn enough about it to know, and I'm not going to venture into there until I feel more educated on it. If you are using it and you're finding it to be helpful and you're doing it in a responsible way and you're not running out of money and you're not stealing things and you're not getting in other trouble with it, be my guest. I'm not going to tell you you can't. But if it becomes problematic, if it becomes something where you are having a substance use disorder, or you're not able to maintain your job or your relationships, then and we think it's due to that, then I might start to say, this seems to be problematic. I don't want to continue to reinforce this. And so if you want to keep working with me, well, we need to make a genuine plan to get you off of that substance. But I know many people who are very well adapted and they're fully functioning and they're responsible, and they use THC or they use CBD to help fall asleep at night, or they use it with their anxiety, or they use it with their pain. And so I can't deny that there is more and more research evidence suggesting that it can be useful. And same with psychedelics. Those are becoming more mainstream too, for end-of-life depression and for a variety of other conditions. So it's very challenging when I live in a society where it's illegal. I can't deal it, right? And I'm certainly not going to formally, recommend it as a clinician. I don't have that opinion, but I also would not be so narrow-minded as to say, you can't see me if you're doing any of that stuff, because some people use it to benefit. So I think it's making its way more into mainstream, especially CBD more than THC.
Yeah.
And so, yeah, no, I mean, that's kind of my take on that. It's fairly evident when you have someone who seems to be using it in a kind of damaging or counterproductive way. At which point, it's your job as the clinician to find out more about how much they're using it, what are they taking. It's so, it's not regulated the same way that pharmaceutical medications are, and who knows which batch or which strand you're getting and which strain you're getting. So it becomes harder to comment on. So I would take every case by case on that. I wouldn't say like, by definition, I'm not going to ever see anyone who's ever had the slightest bit of a substance. Why would I do that? But if I subjectively, as I learn about you, if I see it as an opportunity for us to help you to try and stop using something that is not being helpful to you, then I will.
That's wonderful. Thank you for shedding some honest light on this. Jeremy, I have a question for you, because a lot of times, and people who are not aware of my content is about trauma, also childhood trauma, complex PTSD. The symptoms that you've described earlier in the episode of the lack of focus, so many other things that are linked to the anxiety, to the, let's say, depression. You link them to ADHD, to ODD, but a lot of people find themselves or have these overlapping symptoms sometimes with complex PTSD. And a lot of times I get the comments under my videos, but this is ADHD.
Yeah.
Whereas I say it's trauma. It's a bit of a chicken and an egg situation. Do you think these things can be both happening, that you have ADHD and trauma? Are people with ADHD more because of their brains and maybe their sensitivity prone to have traumas and struggle with complex PTSD?
Trauma shapes the brain. It affects the connectivity within the brain. And it is an exposure, it's an experience and situational thing that was not there at birth per se. You could be born into a traumatic environment, but your brain at birth was not, affected yet by trauma. ADHD, that can be related to your genetics. It can be related to the simple way that your brain grew. Remember we talked about, people have different parts of their brains. And so it's certainly possible that two people who are twins and have the same genetics, but raised in two different households, might both have ADHD tendencies or risk factors, but the one who is in a more traumatic household maybe shaped other parts of their brain differently, where they are more likely to get sidetracked or distracted, or their ADHD manifests in a different way because it's inexplicably linked now to their limbic system, where they're in their amygdala, where they're having panic episodes and stuff like that. And so they do get kind of complicated with one another. And I think they can certainly bring about or exacerbate one another.
I'm curious, are there any ways for people who are listening or watching, are there ways to differentiate between this is ADHD, this is complex PTSD? What can I look out for?
Well, I would say that the PTSD, I would look at where the symptoms are showing up. Okay, so people with PTSD might have harder days and easier days. They might have harder moments and easier moments. If you are still showing ADHD type symptoms when you are having a calm moment, then I'm more likely to think that you have freestanding ADHD independent of the trauma. So we have to look at how your brain is functioning in a moment when you're not triggered or you're not otherwise dysregulated by your trauma. And if the inability to focus persists, then I'm thinking that you have an independent ADHD that might be worth treating. However, if the inability to focus and stay on track and stuff is really only most prominent when you're having when you're having your harder trauma days or moments, then I'm thinking more it's tied to that, if that makes sense.
Oh, that's a good one to look out for. So the one where you can see, the most prominent one is like, can you focus in certain moments? Yes or no? If the answer is no, it can be ADHD related. If the answer is yes, then it's more complex or PTSD related.
Yeah, that way. And of course, also the other way to tell is to simply try and treat one of the things. And if you give a traditional ADHD medication or a therapy technique, and you see the ADHD type symptoms improving, then that's also suggests that you're responding to ADHD treatment. So that suggests that maybe you had some ADHD there. On the other hand, if your symptoms are purely related to your chronic exposure to traumatic events, then an ADHD medicine and changing around our little neurotransmitters and stuff like that wouldn't improve that, because it
I
would be
think
there.
that's helpful. Jeremy, I have two more questions. One question
Yes.
for anyone who is listening, who is relating to this, to ADHD, to everything that you've shared. What's one thing that you would tell someone with ADHD?
Oh, wow. Okay. Does it have to be one? It's so hard. Let's see.
No,
I
it can be
would
more. Go ahead.
Well, I mean, looking back at our conversation, so first of all, try and look for the positives in it, right? Rewatch our episode here and see what we were talking about that, but look for ways in which you can use it to your advantage. When you can, look for ways where you can be creative. We look for ways where you can use your drive towards novelty to your advantage, and use it as a way to better explain your behaviors and anticipate things. Gosh, I should keep in mind, why am I not as, into my job as I was 3 months ago? Oh, wait, I know I have a type of brain that does that. That's just my brain doing what it does. So maybe I can come up with some proactive ways to keep my job interesting right now, because I understand how my brain works, and that will help guide you as well. And then honestly, telling people around you, your loved ones and the people who work closely with you, not from it's an excuse perspective, but to bring them in as part of your support network and hopefully part of your solution, where they can help you overcome it too. And I will tell you, all my coworkers know about my ADHD. We look for the humor in it. I work in a studio that has a clinic and a lot of different areas in it. And I will go out and start eating or drinking something, and then I'll walk somewhere else. And so somebody made a little like Dr. Chapman's cup sign that so nobody touches it,
But I think it's
we
so
lean into
important
it.
not to feel ashamed about the diagnosis.
Exactly, because that will open up doors for you to be able to talk openly about it and then make the most of it. Don't be ashamed about it. It's just the way that your brain grew.
I really love that. Don't be ashamed about it. Embrace it and use it in many ways that actually empower you also in your life.
And your kids and your friends or other people who might be ashamed or not realizing that they have it. And that's part of why I post. Yes, I love attention. I love praise. I love all that stuff. That's certainly part of my ADHD. But also, I know that there are people out there who might benefit from seeing somebody be okay with it and seeing somebody explain it. And it might be liberating for them too.
That's beautiful. Dr. Jeremy, I asked everyone this on my podcast, and you can answer it as long as short as you like, and you can also go wherever you feel like going. But the question is, if you could travel back in time and you could speak to your past self, so you speak to your child self, teenage self, to your yesterday self, so you can decide what time you choose, but what would you say?
All right. I'll think for a minute here, and then I'll give you an answer. And I'm late for a meeting, so I'll keep it short. But I texted her and said I'm running a couple of minutes late.
I'm sorry.
No, I'm just being. She knows I have ADHD, so so I'm using that as my excuse. Oh, it was my ADHD. That's why I'm late. If I could go back in time and talk to my younger self, I mean, I would probably. I guess it's kind of what we were just saying. I would probably say, hey, it's okay to have this. And I would say, trust me, in the long run, as long as you are open about it and as long as you look for the advantages of it, it's going to serve you well and you'll be better for it. I've actually put up a couple clips that are like my advice to a 7th grader with ADHD. I think self-understanding and self-acceptance will go a long way. So I would have avoided a lot of times when I felt ashamed or confused or disheartened or hopeless, because I would say, look, you're going to be okay and you can use this to your advantage.
I like that. That's a beautiful message. Where can people find you if they want to know more or work with you? What's the best way to reach to you?
Well, so we're gonna have to do another episode sometime where we talk about my other stuff, my
Yes.
Shepherd Studio stuff, my Savant stuff, and all that. We'll come back and do that. But for ADHD purposes, so I am on TikTok originally, and now on Instagram as well. The handle is Dr. ADHD, Dr.ADHD. That should find your way to me. And I would love for you to come follow and share your questions with me about yourself or your kids. I'd love to be able to help you any way I can.
We will put it also in the show notes so everyone can
Great.
find you, follow you, and reach out to you if needed.
Please.
Dr. Jeremy, I'm really, really grateful for today's talk, and we on purpose
Likewise.
only talked about ADHD because I will see you for part 2 and part 3 very soon,
Yes.
I hope. And for
Excellent.
everyone who was watching and listening, thank you so much. I think here's the big message. You are not alone with your struggles. And I hope this episode was helpful and empowering for you. And please do not forget to subscribe to my podcast, Real, Raw, and Authentic, to allow me to keep doing what I'm doing, to bring experts just like Dr. Jeremy Chapman here to the podcast so that we can really shed some light on ADHD and other topics and help you on your journey wherever you're at right now. Please take good care of yourself, and I'm gonna see you in the next episode, wherever that's gonna be.